Dr. Elisabeth Rosenthal is with us here at WTOP. Her new book is called An American Sickness, and we are hoping that it will give people a lot of good information. God forbid you have to go to the hospital. Certainly you have to go to your doctor now and again. Elisabeth, can we start with drug prices? They don't seem to follow the rules of competition. If I had a pizzeria on one side of the street and you came along and opened a similar operation, I probably couldn't raise my prices very much, especially if your pizza pie was so delicious. With drugs, we can have 10 or 20 medications to deal with a certain ailment, and yet the prices don't go down, they go way up.
Yeah, with a lot of drugs, we see a phenomenon called sticky pricing, which is a wonderful term. And what it means is when you have a bunch of drugs that are pretty much equivalent for a condition, instead of that creating competition and bringing the prices down as it would for pizza or blueberries or bananas, they all rise to the highest price in the market. So they go to that sticky ceiling. And we see this, the most dramatic example is with with drugs for multiple sclerosis, which is a serious chronic condition. The drugs are fantastically effective, but each year a new drug comes into the market. They set the new price at, say, $7,000 when they've always been at $6,000, and the $6,000 drugs suddenly go up and stick to the $7,000 ceiling. So it's really a faulty, flawed market. You can't even really call it a market.
Yeah, using the word market, you write about as much as the market will bear.
Yeah.
So again, it's up instead of down, and the sky's the limit. It feels like, anyway.
Right, because it is not really a true competitive market. I mean, the rule, the 10th rule of the book, which is kind of the overarching rule, is that prices will rise to whatever the market will bear. And I say in the book, Adam Smith talked about the invisible hand that made markets work and function. I say in the American healthcare market right now, the invisible hand is on the till. And I think, there are all these people profiting, and we're supposed to act like consumers, but we don't have the tools. In a functioning market, price, you can compare different options ahead of time and make choices. The healthcare market doesn't work like that. It doesn't work like that for individuals as patients. It doesn't work like that even for our employers who are buying healthcare on our behalf.
I could Google right now iPad prices or dishwasher prices and get a long list that I could recite to you. Why can't we do that with medical procedures? Or as easily, to be fair, as easily?
Yeah, I think, part of the business model of healthcare providers is to not show prices, right? Because if the place where I had a hernia operation had to post, we charged $25,000 for an outpatient hernia operation, no one would come there, right? It's too expensive and twice as much as the place down the block. So I think it's a strategy. We've let the insurance and provider network get away with that, and we shouldn't. And I think more and more what I want people to do is, okay, if we have to be consumers in healthcare, which is a terrible burden to put on patients who are sick. But if we have to do it, okay, let's start. Let's take action. So, for example, if you get a bill that says your hernia operation costs $25,000, go on some of the great sites that are available now, like Fair Health, like Prater.com, like Clear Health Costs. You'll be able to see what different centers are charging in your neighborhood. And if others are charging $6,000, go back to that bill and say, I'm not going to pay it. I know that this is the average price around here, and I'm not willing to be ripped off. And you know what? Even if your insurer is paying, you should do that, because if your insurer is paying inflated rates for your health care, you're going to pay higher premiums and higher copays and face higher deductibles next year. So it behooves us all to be part of this.
Talk about being your own advocate in the hospital, if you're even conscious. And I don't mean to make a joke, but people are going to be driving by, so to speak.
Yeah.
Hi, I'm John Smith. I'm the dietitian. I'm so-and-so. These people may not be in your network and may be adding tens of thousands of dollars to your bill.
Right. I mean, one of the things that shocked me most as I was researching the book and my previous articles at the New York Times was this phenomena of out-of-network doctors. So you can go to an in-network emergency room, and the doctor who's seeing you is out of network, and you're going to get a separate inflated bill. Now, that's crazy. Likewise, if you're in a hospital bed, maybe your primary doctor saw a rash on your arm and said, let's have a dermatologist come by and see that. That dermatologist may be out of your network. So I think until the system meets our needs by saying, if you go to an in-network hospital, then it's the hospital's responsibility to make sure that everyone who touches you in the hospital is in your network. We have to take action. So we have to question those bills. And there are some templates of letters in the book that will allow you to write to the hospital and say, as is your right. I mean, this is what, as patients, we have to feel that these things are our right. I went to an in-network hospital. I did not consent to an out-of-network doctor seeing me. Therefore, hospital and insurer, you guys work it out. Now, in New York State and a couple of other states now, there are laws actually protecting you in this way and making it illegal or not. They don't make it illegal to try and charge you out of network, but they say you don't have to pay it. But again, you have to know enough and feel emboldened enough to invoke those rights. And we don't. So part of what I want to do with the book is kind of embolden patients, make them understand that they have rights, financial rights, and to exercise those rights. We're also, in the wake of the book, starting a patient movement called WeThePatients.us. So, it's time for patients to assert their rights.
The book is An American Sickness. The author, Elisabeth Rosenthal, she'll be at Politics and Prose in Northwest D.C. on Connecticut Avenue tonight at 7. You'll be signing books, speaking to people, I'm sure, answering a whole bunch of questions.
I love doing this, so.
Thank you very much for stopping by WTOP. It was great to see you.
Thanks for having me.